the menopause would not be incorrect, isn't it? A normal age for menopause, yeah, is I don't think this age, yeah, as I say, normal menopause, yeah, not those the different kind, other kind. Okay, what else?
Can it be the tumor of pituitary gland?
Yeah,
then
write
it will
it down.
affect the
Yeah, you can write it down. Could be. What else? Okay, just now someone was telling me about amenorrhea, isn't it? Someone mentioned amenorrhea, isn't it?
Yes.
Okay, good. Amenorrhea, there's two classification. One is primary amenorrhea and secondary amenorrhea. What do you think this patient has? The primary amenorrhea or secondary?
Secondary.
secondary.
Right. Why you say secondary?
She previously already had the period.
Oh, okay, all right. So that's so I hope that you're able to appreciate differentiate the different type of amenorrhea, primary and secondary. Very good. So my next question is that I'm not sure whether it's part of your learning issue here. Is that do you know what is the causes for primary amenorrhea and what are the causes for secondary amenorrhea?
I don't think so, doctor. Miss.
No, it's okay. You call me Miss. If you do not know, never mind, because we actually in the first PBL. So would you agree we put it as list down the causes of primary amenorrhea and secondary amenorrhea?
Yes.
Yes, Miss.
Okay, good for you to learn now. So at least we are clear, yeah. If when we next week we discuss on the causes that that lead to primary amenorrhea and the causes that lead to secondary amenorrhea, we're crystal clear, yeah. Okay. Back to our differential diagnosis. Aside from PCOS, pregnant, there could be pregnant, and then pituitary tumor. What else would you suspecting?
Miss, is this okay to suggest primary ovarian insufficiency?
All right, put it there. Have you have your pathology lesson yet?
Not yet.
Who's taking? Dr. Busra taking?
No, it's a new lecturer.
Okay, all right. I thought it's Dr. Busra is still with you. Okay, never mind. Okay, anything else? Yeah, any condition that you think of that is related to the clue that's provided in the trigger?
Can it be? I don't know if it's right. It's not an illness. It's like stress. Tapi I don't know if it can go up to 7 months of no period.
Never
But
mind.
I
Put
know
it there.
stress can cause.
Put it there. At least next PBL, we will actually be clear. Yeah. Would a no period of 7 months is due to the stress? Yeah. Okay. Probably we can answer that later on. What else?
Doctor, could it be that she maybe had like a PID and then now she has maybe severe fibrosis
PID.
of her ovary?
PID stand for
The pelvic inflammatory disease, and maybe it reached like it caused fibrosis in her ovary.
Okay. You're saying cyst, right? Cyst. Okay. All right. Okay. You can put it there. Probably when you done your learning issue next week, we are much more clearer and we are able to exclude that. And we can actually based on the lab investigation and as well as yeah, to actually exclude those differential diagnosis. Any more else to add? Okay, we talk about that it could be due to pregnant, it can be due to tumor, it could be due to primary ovarian insufficiency. What else? It could be the cause of it. Yeah, having a period is actually due to what? What caused the period, menstruation?
Endometrium shedding.
Oh yeah, and what govern the uterine cycle? What govern the shading, what determine the shading of the time to shade the uterine walls is due to what?
Hormones.
Yeah, very good. Hormone actually play a crucial role. So do you think that any of the imbalance or abnormality in hormones could cause this condition? Imbalanced hormone is actually a hint to you because you are going to be a future doctor. Perhaps you need to think of what type of hormone is involved that actually prone to this condition. What type of hormone?
Estrogen.
Okay, estrogen. What else?
Progesterone.
Progesterone.
Okay, what else? What type of other hormones condition that can cause this situation?
Luteinizing hormone?
Yes. What hormone is that? I can't hear you.
Luteinizing hormone?
Okay, LH. All right. So that could be when we talk about FSH and LH, it could be a disorder or probably condition that is related to pituitary glands, right?
Yes.
All right. So aside from that, what other hormone condition that cause this situation?
GnRH.
GnRH. Then we were talking about the pituitary.
Hypothalamus.
Yeah, hypothalamus. Very good. What else? Any other hormone organ aside from the hypogonadotropin? Any other hormone condition that could lead to this situation? Sorry?
Cortisol.
Sorry, my place is raining. I try to put my speaker louder so that I can hear you. All right, what do you say just now?
Lectin.
Leptin. Okay.
Lectin.
I actually was trying to link, trying to actually guide, probe you on other hormonal condition aside from the hypogonadotropin.
Cortisol.
Okay. I really cannot hear you.
Cortisol.
Sorry.
Cortisol.
Can someone type it so that I can understand? My play is reading hard.
Yeah, I said cortisol. It's produced by adrenal glands.
Oh, adrenal glands. Okay. Probably can someone type it so that I can actually understand what we're talking about? Any other endocrine organs that you think that involve that you would suspect of?
Doctor, could it be the thyroid hormone?
Okay. Okay. I saw someone mentioned that in the chat box. Thank you so much. Cortisol. All right. Very good. So cortisol and high cortisol level, and I think that would be related to stress. You have it there. What else aside from adrenal glands? What other organ that that endocrine organs that you would suspect of? Okay. Never mind. You have tried your best. All right. So
Doctor, what if it's thyroid hyper?
yeah, you
Yeah,
got it.
hyperthyroidism.
You got it. Very good. Okay. So this condition could be also associated with hormone endocrine disorder like do you think hyper or hypo? Is it thyroid or parathyroid? Okay, never mind. You will find out when you do your list of the causes for primary and secondary amenorrhea. Yeah. All right. This all right. So for me is that you have to know is that it could be due to um, hormonal imbalance. It can be due to tumor. It can be due to congenital. Yeah, when it comes to primary. Yeah. All right. And also certain treatment that they have to the patient are undergoing. All right. Um, um, okay. No worry if you states we know there is a hormone disorder, yeah, but you may not be clear at this phase. Doesn't matter. All right. What do you want to know for progress one is actually on the let me see history ticking. So what do you want to know?
Maybe we can ask if before these 7 months were her periods regular or irregular?
Okay, so we understand that the menses stop at 7 months, past 7 months, but for the past 2 years, the patient have irregular menses.
I would like to ask, is she married?
Um, okay, is she married? Let me see. Actually, not mentioned here. Oh, yes, yes. Sorry. Yes, she's married.
I would like to ask if she's on any medication.
Medication. No, there's not taking any medication at the moment.
Miss, does
Can
it
we ask about the
Yes.
does it associate with pain?
Pain. Uh, pain. What type of pain that you are asking?
Somewhere around abdominal? Something?
Abdominal pain? No.
we ask about the flow, the
Sorry.
normal flow, the period flow, like
The
the
period
amount
flow.
normally.
Um. Okay. Okay. The menstruation. Yeah. During the puberty is regular. Normal blood loss. And yeah, normal blood loss. And there's no what you call it, dysmenorrhea. That means no pain during the menstruation.
Doctor,
Yeah.
does she has any kids?
No kids.
Doctor, I would like to know, when did she get her first period? If she can remember.
Okay. The first menarche at age of 13.
Mm.
She has
Doctor, what
any
about any
What about what? Okay. Can you
Doc.
hold on? Hold on. Give me a moment. I'm trying to close the shutter because the noise outside.
Okay.
Okay, sorry. All right, back to yeah, history taking. So you asked about what you call it? Yeah, medication history. You talk about we talk about menstrual history. What else that you want to know?
Like just now, Rania asked about if she has kids or not. I would like to ask if she did get pregnant before. Any
Oh,
pregnancy?
okay. She has no kid.
So no, not even any pregnancy lah. Can
No.
experience.
So far, yeah, she's married, but she has no children.
Okay.
Doctor, does she have any abnormal vaginal discharge?
Uh, no, no discharge.
Does she experience any headache?
Yes, she has headache.
How about nausea?
Nausea. Well, I don't think that she has nausea. She has indeed a very good, having a good appetite, normal appetite.
Weight loss?
What loss? Oh, weight
Weight.
loss. Yes. It's actually not weight loss, but in fact, in contrast, it's actually gain weight.
Does she experience any excess of hair
Excess of hair.
around like the chest area, or maybe?
I think we are taking history taking, right? You can do that in our progress, the subsequent physical examination. Okay, back to the weight gain. Yeah, is actually the patient gained 5 kg.
Did
What
she
else?
go to the clinic about her irregular menstrual cycle before this?
No. This is where you are now seeking you for the medical attention.
Did she do any excessive exercise?
No.
Does she smoke? Drink?
No. No smoking. All right. You're suspecting this patient have amenorrhea. So, what are the symptoms that associated with amenorrhea you would suspected that the patient would have besides having a headache?
Vision changes?
Sorry, louder.
Vision changes?
Vision changes. No.
Hot? Does she feel hot?
Yes. Yeah. Hot flashes.
Does she have discharge from a nipple or something?
Discharge from where?
From the breast?
From the breast? No.
How about mood swing?
Mood swing. Yes. The patient easily get irritated.
Doctor, does the patient experience vaginal dryness?
Um. Yep. She has a condition, the symptoms known as dyspareunia. Okay, let me type this. Do you know what? Do you know this term? Do you know this term?
Does she feel pain? Does that mean that she feels pain when they're when what is that term?
During
Sexual intercourse.
Thank you.
Yes. And that is due to dryness, isn't it?
Yes.
Okay. Anything else? What would be the other symptoms that associated with this patient condition? Aside that you're asking headache, yeah, hot flash, anything else that you were able to think of?
sweat.
Night sweat, very good. Aside from that, any other things that that come with this condition?
I was thinking about osteoporosis, but I cannot relate with what kind of symptom that we can see.
Okay. All right. Because of lacking estrogen. So,
So is it joint pain?
joint pain, no, but the patient have experienced low back pain. Low back pain.
How about pelvic pain?
Pelvic pain, no.
Okay.
But the patient have low back pain. Okay. Any history that you actually miss out aside from asking the symptoms? You are asking just now. You asked about menstrual history. Well done, very good. You asked about drug history. You talk about social family history, social history. What else that you want to know? What other history that you might miss out?
Family history.
Very good. So what question would you ask?
Does her mother or like her other female family members has experienced the same symptom as her before?
Okay, good question. So her mother actually also experienced actually have stopped menstruating at the age of 40. Okay, I think I would like to distribute the progress 2 to you. All right, hold on while I upload the file. So while I'm uploading the file, perhaps you can consider the information you get from the history taking. How would you narrow down the differential diagnosis? Or you want to add to the list?
I think we can cancel out pregnancy.
All right. Okay, hold on. Progress. Progress 1. All right. Okay. This is your progress 1. Probably someone can read it.
Okay, I can be reading it. So, history of present illness. On obtaining a further history, the patient mentioned that she has irregular menses for 2 years, but the menstruation stopped totally 7 months ago. Since that time, the patient suffered from headache, poor sleep, hot flashes, night sweats, dyspareunia, dyspareunia, I think so.
Yeah,
And low back
dyspareunia.
pain. She has gained 5 kg weight despite having normal appetite. She also gets irritated and frequently depressed. Menstrual history says that she started menarche at the age of 13. Menstruation was regular, 28-day cycle, lasts for 7 days, with normal blood loss and no dysmenorrhea. Medical history said that is not significant, no history of TB or thyroid disorders. There is no surgical history, no drug history. She's not taking any medication. Social history. She is married, working as a banker, and has no children. Family history says that her mother stopped menstruating at the age of 40.
All right. Okay. Any information that you miss out from your inquiry? I think depression was not in your notes. So what do you think? What could have causes these symptoms?
I was thinking about the thyroid because she gained weight, but since the medical history.
Gain weight, right? You're saying? Sorry, again, can you repeat again?
No, I just said that I was suspecting for thyroid, but the medical history said that no history.
Oh, yeah. There's no history of thyroid disorder. Very good. Okay. So we actually can cancel out thyroid disorder, isn't it? In our differential diagnosis. What else? Okay. Can someone? Yes.
Maybe we can eliminate the PID because it's not significant, so we consider she never has PID before.
Based on what?
The medical history.
Okay. All right. In your opinion, what condition? Why is this patient having poor sleep?
Because she feels hot, so she's uncomfortable.
All right. What actually caused this patient uncomfortable?
Is there something wrong with her hypothalamus, Miss?
Okay. Okay. Now, the symptom that is displayed could be short-term and long-term basic. Yeah. Um, do you know which of the signs and symptoms of the menopause? Sorry.
Back pain.
Do you know which of the signs and symptoms is a short-term or a long-term? Anyone knows?
No.
Okay, never mind. Okay, can someone actually upload the scribble board back? Can we put it into our learning issue? Classify the sign and symptoms of menopause into short-term and long-term basic. Meaning to say is that we wanted to know is that which of the sign and symptoms of the menopause is actually short-term and which one is a long-term. All right. Okay. When we talk about amenorrhea, we know that the culprit is the hormone. Yeah. So before we talk about the abnormality of the menstrual cycle, can you put it in your learning issue that you are able to describe the normal menstrual cycle? I think this is your physiological learning outcome, I guess. Okay. Okay. Describe the normal menstrual cycle. Okay. Do you know the source and the synthesis and the physiological roles of estrogen and progesterone? Anyone knows? Anyone knows about the source and the synthesis and physiological role of estrogen and progesterone? If you do not know, probably we could put that in a learning issue and look into it.
Maybe we could put it in there, doctor, just to revise.
Yes.
The
the source, the synthesis. So we need to know is that where the estrogen come from, the progesterone come from. So the source, how is it being synthesized, and where is the physiological role? Okay, when we talk about hormone, we also need to know is that the regulation of this hormone, the estrogen and progesterone secretion, because it cannot be that this hormone be synthesized throughout the years, correct? It need to be regulated, yeah. So and in this situation, is there any perhaps any defect on the regulation? So probably I would suggest that you would put it in your learning issue to discuss the regulation of estrogen and progesterone secretion. If you notice that the shading of the uterine is actually governed by the hormonal event in the uterine cycle. So we also need to know is that how these two hormones are regulated. Yeah. All right. Okay, we did talk about the symptom, the sign and symptoms of this patient. What is the sign and symptom that we see just now? Backache, weight gain, depression, hot flashes. Again, in any PBL, you need to actually able to explain the pathophysiology of the sign and symptom. Okay, so all right. Anything that you wanted to cross out in your differential diagnosis with the information that um, you have? You just cross out from the information that you gathered from the progress one. Perhaps in you can actually decide among yourself which one you would like to cross out.
I think PIT just now Rania suggest to.
Yes. All right. For me, do not delete. You just cross out. Do you have this like crossbar, something like that in the in the Microsoft Word?
I can't find mine.
Oh, okay. Never mind then.
Sorry.
Okay, it's okay. Don't stress yourself. All right. Okay. Okay, then. Okay, we move on to the third progress. The third progress is actually on regarding the physical examination. So what would you like to know on the so you're going to next phase is that you're going to take the you're going to carry out physical examination. So what are you going to do? What are the things that you need to look up for?
Vital signs.
Vital signs, very good. So vital signs, the pulse is 90 per minute. Respiratory rate 18 per minute. Blood pressure 160/90. What else?
Miss, what about her appearance?
Sorry, can you speak louder?
Her appearance.
Appearance. She looked depressed. She is conscious. She is alert, but she is depressed. She looked depressed. Oh, appearance, right? You say she also appear obese. Anything else that you want to look for?
Any darkening of the skin?
No, there's no darkening of the. What are you suspecting for darkening of the skin?
Because.
Oh, right. Okay, I see. No, there's no darkening of the skin. Very good. Okay. Anything else?
How about hairy?
Oh,
hairy on the face.
You're talking about hirsutism, right? That associate with PCOS, right? No, there's no hirsutism. Yeah, I know a bit difficult. This term is hirsutism. Anything else that you want to look for?
Any lump in the throat?
Any long?
Lump in the throat.
Oh, lump. Where? Where you're looking for lump in where? Oh, okay.
Just to see the thyroid is enlarged.
Okay, all right. Want to see the thyroid? No, there's no thyroid swelling.
Any wrinkle?
What wrinkle?
Skin?
Skin. The skin. There's no wrinkle, but the skin is dry. Dry skin. Okay, beside physical examination, there's other type of examination in progress too. What type of examination that you would take? So again, I repeat, you just now in progress 2, you asked about water sign. Very good. You also asked for the appearance. There is a general examination. Any other particular specific examination that you would like to take?
Is it the pelvic examination?
Very good. Aside from pelvic examination, what else?
Could we check for neurological examination?
We are suspecting what?
Because there was like a pituitary tumor, right? So maybe, maybe the, I don't know, maybe because her brain is not working really well. So probably we could check for like, I don't know really.
Okay, if it's a nervous examination, what type of nervous examination that normally people take? Okay, never mind, because for any tumor, normally they will use scan, yeah, okay. When we say examination, that probably is like probing, um, something like that. So, aside from pelvic examination, what other examination that you would take? What are the things that you would wanted to inspect?
Her abdominal examination.
Abdominal. Okay. You're suspecting what for abdominal examination?
I'm not sure really.
You want to palpate the ovaries, is it? Um, okay. What other else? Don't worry. Please just try.
Doctor, what about vaginal examination?
Okay, per vaginal examination, you are right. You actually nailed it. All right, this is very crucial. Yeah, you must have a per vaginal examination. All right. Okay, I'm going to upload the third. Would that be the what progress is this? Let me check. Um, okay, I'm
This
going
is
to upload
progress
the.
2.
Yeah, yes, definitely. I'm going to. Thank you. Okay. Uh, Hold on, yeah. Bear with me for a while. This is progress 1. Let me close it. Progress 2. Okay. So, oops. Progress 2. Yes. Okay. All right. So, this is your progress 2. Anyone to read it?
I can read it if no one's volunteering.
Okay.
Okay, progress 2, general examination. The patient is obese, conscious, alert, and looks depressed. Her skin is dry, no hirsutism, no thyroid swelling. Vital signs. Her pulse is 90 beats per minute. Her respiratory rate is 18 per minute. Her blood pressure is 160/90. What's mmHg? How do I pronounce that again? Her breast examination is normal and no galactorrhea. Her pelvic examination, her external genitalia urethra is normal. Her per vaginal examination, she does have atrophic changes within the vagina, but no provoked bleeding on examination. Her cervix and uterus, there are no pelvic masses, and her uterus is normal sized and mobile, and her ovaries are not palpable.
Hold on. Let's further down. Hold on, bear with me. Um, okay. What else?
She does not present any signs of pregnancy, and the other examinations of the other systems is normal.
Right. Okay, I think that's the end of it. Yeah. Okay, what is your finding from this progress? Is the vital sign normal?
Normal.
Are you sure?
High BP.
Yeah. Okay. It's actually elevated blood pressure. Yeah. All right. Okay. Okay. If you notice here, there's no galactoria and no the other is hirsutism. All right. Can you explain the absence of these symptoms? Why these symptoms are absent? Um, if you could not able to answer, it's okay. Perhaps someone can suggest to put it in the learning issue. Yeah.
Yes, please.
Okay. Explain the absence of hirsutism and galactoria in this patient. All right. Why is this patient not presented with galactoria and hirsutism? Yeah. Okay. Aside from hold on, let me delete this. We notice that this is elevated. We also notice that there is this anatomical changes. Yeah. Okay. Uh, um, can someone able? Do you think that anyone can able to explain about these changes related to menopause? If not, can we put that as a learning issue? Explain the anatomical changes in menopause and relate them to clinical presentation. So can we see the scribble board, please? Back to our scribble board. Okay. Yeah. So explain the anatomical changes of menopause. Okay. Explain the anatomical changes associated with menopause. The anatomical changes that associated with menopause. So when we talk about the anatomical changes, it's actually referring to the atropical. What is this now? The in progress too. We actually related the atropic changes within the vagina. Yeah. All right. If you're actually not clear what the anatomical changes here, you can put it in a bracket. We are actually, yeah, atropic changes within the vagina. Yeah. Okay, associated with menopause. All right. Okay. We have done our progress too. Okay. Any else? So we have collected the information from the progress 2, anything that you would like to fine tune your differential diagnosis?
Could we check for her FSH and LH and like estrogen and progesterone serum level?
Yes. That will be in our progress 3 because progress 3 is a lab investigation, lovely. So you know what to look for, right? The hormonal level. What else? Aside from the FSH, LH, and estrogen, progesterone, what else that you would what type of lab investigation you would call for?
Can we do an ultrasound, doctor?
Ultrasounds. Okay, ultrasound. Which part?
Like her uterus and vagina.
Sorry.
Her uterus and vagina.
All right. So that is in the pelvic region. So pelvic ultrasounds, very good. What else? So you have your pelvic ultrasound. What else? Just now the patient is actually presented with no absent of galactoria, right? I don't know
Yes,
why.
miss.
Yeah, yeah.
Yes.
They have breast examination on this patient. They done the breast examination and they say there is normal and no galactoria. But I do not know why they also still doing the mammogram.
Prolactin or
Huh?
mammogram?
Yeah, they in your progress here, they want to do the mammogram to check the condition of the breast as well. Okay, what else that you actually will call for the test for this patient? If you actually suspected the patient with the pituitary tumor, what type of examination that you will call for this patient?
MRI.
Right.
Yeah, yeah. But okay, let's say that you are actually with limited budget, so you have no MRI, so you will call for what?
CT scan.
Yeah, CT scan also quite expensive. Okay, over here they say that they're also looking for the skull X-ray as well. All right. Okay, one more important exam that you have to call for this patient. What would that be? Very important.
Doctor, is it the speculum examination?
What?
Speculum. Speculum.
Speculum. Can someone type so that I understand what test is that? What test is it? Oh, speculum. All right. What test is this? Can someone enlighten me? What test is this? What is it this test for?
It's to look inside the vagina and then observe the
Okay. All right. All right. So that is actually a tool. So I would referring to that is actually a tool. All right. Actually it's meant for pap smear, isn't it? Is this tool used for pap smear? Yeah. So okay. Let's move on to progress 3. Let me upload it. Okay. Okay, I upload the progress 3. Okay, so the progress 3, all right, the first lab investigation is on the FBC. All right, can someone go through it?
I can. So for the RBC, normal. Hemoglobin slightly low. White blood cell normal. Neutrophil normal. Eosinophil normal. Basophil normal. Lymphocyte normal. Platelet normal.
Yeah, in normal range, yeah? So nothing suspicious here. Okay, let's look into the next profile. So you have FBS and then random profile and the LFT, liver function test. Someone go through it?
Okay, for the fasting blood sugar normal. For renal profile, urea normal. Creatinine also normal. For liver function test, ALT, AST, and ALT all normal.
Oh, normal, yeah. Okay, let's move on to the next examination. So this is a panel of hormones. Yeah. Okay, can someone go through it?
Okay, for FSH, high. For LH, also high. For estradiol,
Okay, day 2 to 5 semicolon, my dear, and then 185 to 1625. Yeah.
okay, thank you. So it's low. For progesterone is low. For the prolactin, low. For TSH, normal. For T3, normal. For T4, low. Pregnancy test and negative.
Negative, all right. So let me go through it. 2.5 thyroid. So TSH is actually normal level, so nothing to do with thyroid disorder, isn't it? So we actually can exclude the thyroid hormone level, right?
Yes, miss.
Yes. Okay. All right. Okay. There is this question here. Is that can you please justify why it is necessary to measure prolactin and thyroid hormone level? Oh, okay. We haven't finished this. Yeah. There are the remaining examination. Sorry.
Okay, for the skull X-ray, normal, pelvic ultrasound, normal size ovaries, but no ovarian follicles. The uterus normal size, but with thin endometrium. So mammogram, normal finding breast, pap smear, normal result.
Right. So I think the mammogram is actually to confirm, to actually exclude the what is the condition just now? The back to the progress 2. Um, so yeah. So they're doing the mammogram to actually confirm there's no galactoria. Yeah. Um, So, in your opinion, why are they doing the carry out the skull X-ray? And
To see,
yes,
to see the tumor.
uh, the tumor. Okay, and why are they doing measure? They ask for the to check the prolactin and thyroid hormone level. What are the things that they wanted to exclude? Why are they measuring the prolactin and thyroid hormone level?
Prolactin, maybe because of hyperprolactinemia.
All right. If it's hypoprolactinemia, that would cause galactoria, isn't it?
Yes.
And what about thyroid hormone level? Why are they wanted to call for examination thyroid hormone level? So never mind. Again, this is actually part of your learning issue here is that justify why it is necessary to measure prolactin and thyroid hormone level and to do the skull X-ray. So this is actually the whole learning issue here. Justify why it is necessary to measure prolactin and thyroid hormone level and to do skull X-ray. Do you get it? Am I too fast for you?
Justify the reason.
Justify why it is necessary to measure
Okay.
prolactin and thyroid hormones level and to do the skull X-ray on this patient.
Okay.
All right. Okay. The next is the next learning issue that you need to do is interpret the laboratory result of this lady. So that will be next PBL, right? So put in your learning issue. Interpret the laboratory result of this patient.
Miss.
Okay, all right. So we over here is that the FSH and LH is what is the level is pretty high, isn't it? FSH and LH the level is pretty high, right? Higher than the normal level, isn't it?
Yes, miss.
So what you are suspecting while the estradiol and the progesterone is actually quite low. So and the result come over here is that there's no ovarian follicle. There's no more ovarian follicle. It's depleted. So how can you explain of this level of hormone related to your regulation of the estrogen and progesterone? Why is this FSH and LH is high and estradiol and progesterone is low? Anyone able to explain?
FSH and LH is high because of the negative feedback.
Very good. Negative feedback from what?
From the estradiol and progesterone. So the body tried to compensate more by releasing more FSH and LH to increase more estradiol.
The negative feedback is actually based. The negative feedback is based on which level?
The FSH and LH because of the estradiol and progesterone.
All right. Never mind. We could actually discuss further, but actually, over here we actually can conclude here is that there's no more ovarian follicles. So there's no more follicles that will grow and go through the ovulation and become corpus luteum, because only corpus luteum would secrete the inhibin. Yeah. All right. But anyhow, I think one of your learning issue is to able to explain the normal menstrual cycle. So and how the regulation of hormone. I'll leave it for next week. So let me check in whether I did go through all the learning issues. Okay. So done with this, there will be your progress 4. So what with this finding that is presented in your progress 3, what would you suspect that this patient has?
Is it the primary ovarian insufficiency?
Primary ovarian insufficiency. What is the criteria to have primary ovarian insufficiency?
From what I read in the afternoon just now, it says that when your when your ovaries can't function anymore before you turn 40, I think. And since the patient is 39, so I just assume it's primary ovarian insufficiency.
Okay, based on that, anything else? For primary ovarian insufficiency, do you think that the menstruation would actually stop for past 7 months?
Oh, maybe it should stop longer than that.
Because that's why I'm asking is that if you think it's suspected it's primary ovarian insufficiency, then the signs and symptoms associated with the primary ovarian insufficiency is irregular skip period, but for this patient, it's actually for the past 7 months. Actually, there's no menstruation, isn't it? And then there's irregularity in the 2 years, isn't it? In the period of 2 years.
Yes, miss.
Yeah. So I don't think primary ovarian insufficiency could be the differential diagnosis. What else? Anyone?
Can it be because?
Why you say PCOS? What is the sign and symptoms associated with PCOS?
Amenorrhea.
Yeah, amenorrhea, good. What else?
Gain weight.
Yes, gain weight. Yeah, you're right. You're right. What else?
And then
but there's one part that's in
Depression.
the depression. Yeah, that's right. But there's one part here. You say that this patient is not presented with hirsutism, isn't it?
oh yes, me.
So hirsutism is also associated with PCOS, but this patient doesn't come with this. All right. Okay. Never mind. I'm going to upload the progress 4. There, can you see the progress 4 on your screen?
Yes, miss.
All right. actually it's a primary ovarian insufficiency. Sorry on my part.
It's okay.
Okay. All right. Yeah, as I say, for me, my suspicion of primary ovarian insufficiency is supposed to be irregularity, but it's never about no. But perhaps on the later stage of the primary ovarian insufficiency, then there's premature menopause. All right. Okay. Can someone read?
I'll read it.
All right. Thanks.
The patient is diagnosed as premature menopause due to primary ovarian insufficiency. Patient is treated with hormonal replacement therapy, HRT. Patient is asked to book in the HRT clinic for regular checkup. Both patient and her partner are advised for counseling about having children.
Okay. All right. All right. Thank you. So, okay. Again, in any of the PBL, you ask about explain the pathogenesis of the premature menopause experienced by this lady. Am I too fast for you? Explain the pathogenesis of.
No, miss. I'm good.
Okay, you can catch up, huh?
Yeah.
Explain the pathogenesis of premature menopause in this lady. Okay. Explain the term or a primary ovarian insufficiency.
Okay.
All right. Okay. Just for brainstorming section here, what would you think? What type of complication would this patient would experience as part of the premature menopause? Any complication that this patient would have?
Could it be osteoporosis?
Very good. Osteoporosis is one of it. Anything else? If not, we would put it in the learning issue, discuss the complication of premature menopause.
Okay, miss.
Right. Okay, 1, 2, 3, 4. So this is actually the last progress. And what else? Discuss the complication of premature menopause. All right. As usual, which is actually very important, outline the management of menopause.
Okay.
And the last one, discuss the psychosocial issue in this lady. So if you notice here, the PBL is always about pathophysiology, pathogenesis, management, and always we're ending with psychosocial issue. Yeah? What you will be expecting, yeah? The psychosocial experience by the lady. All right, so far, I'm sorry for my part here with the hearing wise and then the raining just now. Yeah.
It's okay, miss.
All right. So anything else? If not, I will upload this trigger and the progress onto your teams. Yeah. Anything else? Any else that you want to? Because I've been long time. Yeah, probably 2 years. Handling PBL. Yeah. So kind of like rusty in my skill. Yeah. So anything else that I can improve or you can improve or whatever? Anything else? If not, we end here. So our second PBL will be next week, right? So do you think we can stick with the same time as 2:30?
Sure, miss.
All right, great. All right. So with that, I hope that you would dedicate the topics, the learning issue among yourself.
Yes, miss, will do.
Okay, and then, all right. So for the next PBL, make a case summary. Yeah, normally the case summary is very important. Yeah, so it actually summarize the whatever the trigger and based on the trigger and the progress, you create the case summary. All right. What else? And then perhaps you compile all the learning issue, and then for handout later on, you can hand out the whatever that in your learning issue, the answer to your learning issue, and as well, yeah, the last part is your concept map. Concept map, yeah. Okay, so please prepare your concept map as well. So, anything else that I left out? I know that these are the learning issues are very important because this is the learning issue that is related to your examination as well. So, so I'll try my best, yeah, and we will discuss that next week. All right. Okay. So with this, thank you so much. I'll see you next week.
Okay, thank you, Miss.
All right.
Thank you, Miss.
Welcome.